thin, short women of Chinese ethnicity are evidently at the highest risk of hip fractures here in Singapore. And that rather startling finding has emerged from the country's largest study on this condition. Researchers are saying that it is significant because it raises awareness about a problem that is linked to high mortality risks.
Wendy Wong is 56 years old. The petite woman also suffers from osteoporosis, a disease that causes bones to be less dense and weaker, and hence highly susceptible to fractures.
There was no symptoms, so I thought I would want to get myself screened because I thought I fit the profile of Asian women, being small built, that's more prone to having osteoporosis. So I decided to take part in the study, and that's how I got screened. And results came out that yeah, I had osteoporosis.
According to a joint health Ministry-NUS study from the year 2000 to 2017, a profile like Ms. Wong's is at the highest risk of osteoporosis, which is a common cause of hip fractures. Their local study of 36,000 patients 50 years and older found that Chinese women had fracture rates 1.4 times higher than Malay women, while the rate was 1.9 times higher compared with Indian women. Overall, women were 2 times more likely to fracture the hips than men, and researchers put this down to menopause.
Menopause, the estrogen levels goes down. So after 50, when the estrogen level goes down, bone mineral density goes down by 1% a year. So when you reach about 70, 80 years old, the bone is so weak that it's very fragile, and if you do fall, then the chances are that there might be a fracture.
Researchers are concerned because overall hip fracture numbers have nearly doubled during the period of their study as the population got older. And 5 in every 100 people who suffer hip fractures end up dying from associated conditions like stroke.
Hip fracture is not in the public consciousness so much. People think about cancer, about the diabetes, about heart disease, but it does cause a significant number of deaths. So I think it's something worthwhile knowing about and preventing, because if it happens, then you don't die immediately, but you die within 1 year, 1 quarter, and then permanent disability.
And that's why the study's authors are spreading the word. They recommend that women start reducing their risk factors early by building core muscle strength and practicing balance through exercises like yoga. At-risk women should also get screened instead of waiting till a fracture happens.